I think the encouraging thing is that we have some idea what's going on. We have had, the law has been identified. We know what's going to take place in the next, 2 years. And I think that's encouraging because, otherwise we'd be in limbo. And it's a very complicated, very expensive limbo to be in. Number one, there's some things that are happening that are very positive. I mean, number one, the areas involving insurance coverage. Having insurance companies allowed to exclude people because of pre-existing conditions. Having the ability to have your children on up to the age of 26. Not having lifetime limits. Those are all good things, and those are taking place and have been taking place already. And I think there are a lot of people that recognize the value of those. I think what today represents is the fact that there are things that aren't going to change that we were concerned about because, both the American Medical Association and the American Hospital Association made compromises on reimbursement to get this thing going, recognizing that once they got the additional people covered by insurance, that there would be some return on that. We'd get some of the money back. We really question if it had been thrown out, would those compromises have been changed back. We think that we'd have still lost those funds and not got the other side of it. Other things that are happening, like the readmissions. Hospitals are working very aggressively to reduce the amount of readmissions that come back in the hospital within 30 days. And there's been a lot of very progressive effort taken to try to make progress on that. This is good for society. I think there is efforts made to reduce cost. We're putting our new our new electronic medical record, EMR, in. That's an $87 million project for us. But we believe it'll help us to be even stronger in doing the things we got to do to provide the best care to our patients. I would hope that both parties recognize that the number one priority is to work together on that to make it better. It can be refined, it can be made better than it's planned right now, but both parties got to put aside the politics and stop using it as a weapon and recognize they have this obligation to the people to get it fixed. If I were to talk for other healthcare providers, that's what they're telling me. Look at some good parts, some things that we have some concerns about too. Let's work together and fix them and make it better. But healthcare is not going to go away. We presently have 40 to 50 million people in this country that are uninsured. That is not a good situation.